Contraception means prevention of conception, that is, prevention of fertilization of ovum, and thus to stop reproduction. Various methods or agents used for contraception are called as contraceptives, and these are as follows. The contraceptive measures that are used in case of males are barrier methods. The aim of these methods is to prevent live sperms from meeting ovum. For example, condom. Condom is a sheath or covering made up of latex rubber, mostly coated with spermicides and made to fit over male external genitalia. Some of the advantages of condoms are they prevent transmission of sexually transmitted diseases including HIV or AIDS, and they have no hormonal side effects. Some of the disadvantages are like latex condoms can cause itching or they can lead to allergy to the latex in few individuals. The condom hampers the sexual pleasure. Condom may rupture during fertilization, and rupture they may lead to fertilization. Second one is coitus interruptus. Disadvantage is slightest mistake in the timing or in the withdrawal or even a drop of semen is sufficient to cause pregnancy. The third one is permanent method, that is vasectomy. Advantage of vasectomy is it is relatively safe and convenient method. Some of the disadvantages of vasectomy are about 50% of the vasectomized patients develop antibodies against sperms. So in those patients wishing to restore fertility at later stage, success rate after restoration of VAS is only 50%. Some of the drugs like Gossipol, which is a spermicide, can be used. Disadvantage is these drugs are too toxic to be utilized clinically. And the testosterone can also be used. Disadvantage of testosterone is that high doses of testosterone causes sodium and retention of water. Contraceptive methods used in case of females. Some of the conventional methods are using cervical diaphragm. The disadvantage of using cervical diaphragm are like it requires trained person to demonstrate the technique, and local infection can be caused if it is left in the vagina. The second one is douches. Disadvantage of these douches is it produces burning sensation and irritation locally besides producing messiness. Then there can be rhythm methods which involves confinement of sexual intercourse to a safe period only. Then some of the permanent methods like tubectomy, that is bilateral ligation of the fallopian tube. Advantage of this is it is relatively safe and permanent means of terminating pregnancy. And also the intrauterine devices, implantation of foreign body into the uterine cavity for contraceptive purposes are the methods of contraceptions. There are different types of intrauterine devices which can be non-medicated IUDs or inert IUDs. So these are referred to as the first generation of IUDs. It comprises of inert or non-medicated devices usually made up of polyethylene or other polymers. They are available in different sizes and shapes. They can be loops, spirals, coils, or rings. The lipase loop is the best known. The intrauterine devices causes foreign body reaction in the uterus, causing cellular and biochemical changes in the endometrium and uterine fluids that impair the viability of the gamete. They also prevent implantation. Copper IUDs, that is second generation of IUDs, by adding copper to the intrauterine devices. It was found that copper has a strong anti-infertility effect. For example, copper T. Copper seems to enhance cellular response in the endometrium. By altering the biochemical composition of the cervical mucus, copper ions may affect sperm motility, capacitation, and survival. And it also affects the enzymes in the uterus. The third one is hormone releasing IUDs or third generation IUDs. The most widely used hormonal device is progestasert, which is a T-shaped device filled with 38 milligrams of progesterone. It acts by increasing the viscosity of cervical mucus and thereby prevents sperm from entering the cervix. Some of the advantages of these are these are the long-standing and long-term prevention of pregnancies possible with IUDs. They're very effective and there are no side effects, and there is no interaction with other medicines. Some of the disadvantages that the chances of ectopic pregnancy is very high with intrauterine devices. Menstrual changes in the first 3 months with occasional spotting between the periods can occur, and if these devices left for longer intervals, they tend to lose their efficacy and may cause intrauterine infections. And they provide no protection against STDs. The other method is contraceptive pills. The contraceptives can be different type, classical or sequential pills. Classical or combined pills. It contains orally active progesterone combined with small amounts of estrogen. The pill is given from 5th to 25th day of menstrual cycle. The mechanism of action is they act on the hypothalamus and inhibit the secretion of LH, and inhibit the secretion of LH leads to inhibition of ovulation. That is, they prevent LH surge. Advantages of these contraceptive pills, they are very effective when used correctly, and they helps to prevent endometrial and ovarian cancer, ectopic pregnancy and ovarian cyst. And the other method of action is they make cervical mucus thick. Some of the disadvantages of oral contraceptive pill are nausea in the initial stages taking the combined pills. There can be slight weight gain. There can be breast tenderness. There can be decreased milk quantity and quality in breastfeeding women. On long-term use of oral contraceptive, there is high risk of thromboembolic phenomena. They're not effective unless taken every day, and they does not provide protection against STDs like HIV. Sequential pill, high dose of estrogen for 15 days followed by 5 days of estrogen plus progesterone. This inhibits ovulation by suppressing the release of both FSH and LH. Some of the disadvantage of sequential pill is it increases the incidence of endometrial cancer. Then the third type of pill is postcoital pill or morning after pill. Administration of large doses of estrogen. It is recommended within 48 hours of unprotected intercourse. The method employed is to give double dose of combined pill, that is 2 pills immediately followed by another 2 pills 12 hours later. Some of the advantages of this is it can be used by nursing mothers after childbirth, and it will not affect the quantity and the quality of breast milk. It helps in prevention of endometrial and ovarian cancer. Some of the disadvantages of morning after pill is it leads to changes in menstrual bleeding patterns. There can be breast tenderness. There can be risk of ectopic pregnancy and headache. The fourth type of pill is mini pill or micro pill. Here, the low dose of progesterone throughout the menstrual cycle is used, and this prevents fertility without inhibiting ovulation. Then the fifth type are progesterone antagonists. Progesterone antagonists like mifepristone is helpful in producing abortion. These are the different methods of contraceptives that have been used. Like in males, it is condoms. In females, vaginal diaphragm or cervical cap, or there can be utilization of the intrauterine devices of for different generation, and there can be utilization of oral contraceptive pills like combined pills, sequential pills, morning after pills, and also some of the permanent methods like in male it is vasectomy, and in case of females it is